Bonetta shared with us this week in the client group that she feels like there's more clarity in her vision, headaches are gone, and she has lost some weight, which was her goal. And Ali told us this week she has no more joint pain, so she could do her workout smoothly. And before she had pain doing the workouts. And another client has shared that she's able to eat tomatoes now, she can eat garlic, and she's able to focus and study. And another client has shared with us that every day is getting better in general. I can tell the inflammation in my body is less, joint pain is too, mood and energy are improving by day. Thank you so much for sharing that, Mariella. And LaDonna just made a post in a client group. I really appreciated LaDonna today. She made a post that she has been has not had any fibromyalgia symptoms and Hashimoto's, anxiety, insomnia. These are the things that she has been struggling with. Please go to the client group and read her post for your motivation and inspiration. Okay. Thank you so much, LaDonna, for sharing that. That just made my day. I really appreciate you. It was so kind of you to go, and wonderful.
So today, I woke up and my double vision improved like 70 to 80%. And I want to cry because, you know, I have thyroid eye disease, and it just happened to me like a few weeks ago, and I can't see things normal. And that's really stressed me out. And today, this morning, oh my God, you know, I can see things normally. And I was like, oh my God, this really happening, you know? And I'm really happy about that. Yeah, I just want to cry, you know.
Thank you so much, Ali. Yes, yeah. So Ali has Graves' disease. So now her double vision, it seems like it has improved. What is the underlying triggering mechanism for autoimmune diseases, and how do we stop the progression of diseases? And we also talk about autoimmune diseases, as you know, it's chronic diseases. So this is also related to any type of chronic inflammatory diseases, whether it's diabetes, high blood pressure, high cholesterol, or fibromyalgia. So it's really about epigenetics, your diet, your lifestyle, the change in the environment, and improving your belief system as well when it comes to healing from these diseases. And why do people in the US and Western world, why do these people get this type of autoimmune conditions? They're the most common in these countries. So again, COVID is pro-inflammatory, that also triggers a body, inflammation in the body, and long haul COVID is actually considered to be a chronic disease now as well. And all of the clients who had long haul COVID were able to recover within 3 weeks in the program. So what is an autoimmune disease? When you open the textbook, an autoimmune disease is when your body attacks itself. So the suffix itis, it means inflammation, which came from the word fire or flame. So you see dermatitis, or you see colitis, arthritis, all of this is inflammation. So inflammation is not always bad. Inflammation controls hundreds of biological mechanisms of keeping the body in balance. However, when it's uncontrolled inflammation, that's what triggers our genes for disease. So too much inflammation becomes a problem. So we're going to be talking about what might bring this about. It's about the antibodies that your immune system makes antibodies against its own tissues and cells. So it manifests in these diseases like rheumatoid arthritis, systemic lupus, Crohn's, but there's also many conditions commonly treated in primary medical care that have an autoimmune component. So for example, eczema has an autoimmune component, or the wheezing sound asthma, atopic dermatitis, and all of these are autoimmune diseases. So acute inflammation versus chronic inflammation. So acute inflammation is when you have an allergic reaction, or you have an infection, or you have an injury or a cut. So that's an acute inflammatory response. And even fever is an acute inflammatory response. And we want to have fever because this helps your immune system fight infection, the virus that you have, the bacteria. But the problem is when the fever becomes chronic, or in the beginning when you have a wound or your ankle swells, and that's an inflammatory response to trauma and the healing aspect, and the body tells you not to move your ankle so it can heal. So the body needs to heal from the damage. So acute inflammation in general has an important role of telling us that something's going on and we need to pay attention. So for most of us, we are moving into chronic inflammation, where we are seeing chronic diseases from heart disease to neurological diseases to cancer, and we want to learn how to reduce that successfully. So that's why chronic inflammation is in case of lupus, people have fever, fever becomes chronic. So in many cases, many organ systems are involved with autoimmune diseases. You can get rheumatoid nodule in the skin, you can get fibrosis in the lung, you can get rheumatoid lung, and you can get rheumatoid heart. So the blood vessels can also get inflamed from inner lining of these antibodies, autoimmune antibodies. And you can get inflammation from the sclera and cornea of the eye. In fact, we've had clients who had neuritis, so they had inflammation in the optic nerve as well, that reversed in the program. So you can see on this picture that all of these are total body diseases. So in rheumatoid arthritis, the antibodies are made largely against your joint proteins, your cartilage, synovial membranes, and collagen. So on the other hand, the target organ in lupus is connective tissue. And connective tissue is found in different parts of the body. And you can see on this picture that lupus affects all organ systems and certainly the kidneys. And we've had great success reversing kidney damage and autoimmune inflammation. And it can also affect lungs, joints, skin, and heart. Anemia also shows up in the blood. So that's why sometimes people can be anemic due to illness. So that's one thing, that addressing your illness is going to help you improve everything else in the body, diseases. So when you ask your rheumatologist or research rheumatologist, the question is, what is the cause of this autoimmune disease? Why does the body do this? Which we're going to talk about in this class. They will give you also sorts of molecular mechanisms. But when you ask them, do you think that what the patient's eating has any effect on the initiation of these conditions or even reversal? So this type of question is often dismissed. So the rheumatologist will tell you, well, there have never been any studies showing that diet makes any difference, or what the patient eats has no effect on the disease. In short, they will tell you diet doesn't matter because there's no evidence. This is what the patient hears from the doctor. And it's sad because now we know that there are many studies that show the connection between diet and autoimmune diseases, which I am also going to share with you in this class. But why aren't there hundreds of studies? Why aren't there hundreds of studies like we see with drug medicine? So there are many studies that show the cause and cure for the disease. Why aren't we seeing the same with autoimmune diseases? So there's a couple of reasons. The first reason is diet is not foremost in the medical literature. As you know, a journal, it's a business, and like any business, they're interested in hot topics. So they're interested to see the difference between the medicine and drug and how it can decrease your symptoms or your autoimmune markers. So to see the difference in real people eating real food is different than testing a drug. So with a drug study, we can take thousands of people and we can give them a pill. And half of those people will have the drug and half of them will have the placebo, so not the actual medicine. And the patient doesn't know the difference between the two, and the doctor doesn't know the difference between the two. And the study is done and they look at some kind of objective marker over a certain period of time, whether it's a blood test or they look at the clinical effect of that medicine. And that's how drug studies are done. And people say, well, we should be able to do that with food. But the reality is that we are talking about human beings and their diet. We can't do this kind of study with nutrition because with nutrition, we can't just give you pill and look at it 90 days. Because with nutrition, we have to control what the person is eating. So, and it cannot be a blind study. The person knows what they're eating, and we have to minimize the variables. So we have to minimize the variables. Inflammation comes down, and the autoimmune antibodies disappear. They start disappearing from the blood work, which is what indicates disease reversal, where your symptoms improve and your antibodies disappear from the blood work.